Hi, everyone. We'll just give it a brief moment for people to connect their audio before we get things kicked off. All right. Good afternoon, everyone, and thank you for joining HHS's briefing on the response to the cyber attack on Change Healthcare. My name is Betsy Weand, and I'm a policy advisor in the Office of Intergovernmental and External Affairs here at the Department of Health and Human Services. This briefing is open to the public. However, the conversation should be considered off the record, and any press inquiries for HHS should be directed to the press office at media@HHS.gov. There will be time at the end for Q&A, so we encourage you to submit your questions using the Q&A function at the bottom of your screen at any time during the briefing. We will also try to answer previously submitted questions that we received through the registration portal. We here at HHS recognize the urgency and the impact this cyber attack on Change Healthcare has had on all healthcare operations across the country. During today's call, you will hear from leaders at HHS as well as those at UnitedHealth Group about the response to this attack. You will also hear about how healthcare providers can access funds from Medicare and United to ensure financial viability. I'd now like to turn it over to HHS Deputy Secretary Andrea Palm for more on how HHS is helping providers and the work we've done to strengthen cybersecurity resiliency across the ecosystem. Deputy Secretary Palm, the floor is yours.
Thank you so much. Good afternoon, everybody. Thank you for being with us. As was introduced, obviously we are well aware, as you are, of the impacts that this Change cyber attack has had on the healthcare sector. We here at HHS and across the Biden and Harris administration really moved quickly on day one with our colleagues at Change to deliberately and with intention use the authorities that we have to lean in and do everything that we can to mitigate the cash flow issues that the healthcare system is experiencing. Our top priority really is, and our role in this response really is as the sector risk management agency to coordinate efforts to really avoid disruption in the operations of the healthcare system, obviously with the safety of patients and their access to healthcare as the driver behind all that we do here at HHS. And we really have been doing that work again, intentionally and deliberately since day one. We've met a number of times, including yesterday, with UHG leaders and others in the sector, both providers and payers, and really talked about this last mile of our providers who really are still able to process less than half or none of the claims that they have pending because they are reliant on the Change system, and really talked about how we work together to make sure that no provider is left behind, and that we are doubling down, all of us, in our efforts to make sure we do the outreach and make the connections with providers who still are struggling and need relief in this current situation. And so again, this experience really has showed us the need for us to work together. We have a particular set of statutory authorities here at HHS, and we have really leaned in to use them. But it is in partnership with providers, with payers, that will really be able to do the work that is necessary together to get us through this current incident. And as you all know, but it bears repeating, as the Sector Risk Management Agency, our colleagues at ASPR, this Administration for Strategic Preparedness and Response, really is the coordinator within the HHS family, and they stood up their interagency response team on day one. And then our colleagues, as you all well know, at CMS earlier this month announced a series of programs to ensure, again, that we are leaning in, using our authorities to make advanced payments to really help do the work that is necessary here, regulatory flexibilities, et cetera, to make sure that providers can meet payroll and do the work that they need to do to serve patients. And again, we have served in this coordination role, leaning in with our authorities to do this work, and recognize again that we need to make sure that we're doing the work with UHG and continuing to press them as the responsible party for leaning in and being transparent and making sure we all have the information we need to be partners in this effort. Overall, this incident is yet another reminder of the interconnectedness of our domestic healthcare system, right? There's not any part of it that wasn't somehow impacted by this. And it's our role to really think about what we've learned here, what we've learned from other incidents, to make sure we are building the capacity and the resiliency of the healthcare sector. Again, since we all share this common mission of making sure that patients have access to the care that they need when they need it. And so, as many of you know, we, over the course of the last year or so, have been developing and rolling out a plan that has a number of pillars that are focused on increasing our protections, our preparedness, and our resiliency in the cyberspace, including a $1.3 billion budget proposal to provide payments to low margin, low I'm not getting the word right here. Low margin hospitals are CAUSE and others, to make sure that they have some resources to adopt the best practices in cyber, and then an incentive program to get us what we hope is from good to great. That is predicated, that is anchored in our cyber practices, which we released earlier this year. And we have been very clear that we intend to fold those best practices, these CPGs, into our programs moving forward, into Medicare, into Medicaid, into our work with the HIPAA security rule, and across the levers that we have, again, to get us moving in the right direction so we are better prepared, we are more protected, and then we are more resilient to do this work moving forward. We're going to need to do this all together. We're going to need to work with Congress to get this across the finish line, and we are anxious to do that at HHS, but recognize in this current moment, we are still focused on the immediate response and making sure, again, that this last mile, this last group of providers that continue to have real claims flow issues, that we're doing the work that is necessary to get them through this current next couple of weeks, so they are able to remain viable in serving patients. So much appreciation for all that you have done in partnership with us to move this forward. And with that, Betsy, I think I will turn it back over to you to move on to the rest of the program.
Thank you, Deputy Secretary Palm. And now I would invite your counselor, Dr. Syed Muhyiddin, to give us a little bit more of an overview of what happened on February 21st and where we are now.
Absolutely. Thank you. And to my fellow physicians in this sacred community, for those of you that are not well versed in the world of cybersecurity, I'm sorry to welcome you in this way. Unfortunately, this is a threat that has grown, as DepSec said, quite a bit in the last few years in healthcare, and that trend line is not changing. So it's really incumbent on all of us to step up and protect our systems, because it could happen to any one of us. But with that, I want to give you guys, like Betsy said, a little bit of, hey, what happened and what has happened since, and where are we going, right? So on February 21st, Change Healthcare, which is a subsidiary of United, discovered a ransomware actor had penetrated their systems. They immediately shut down their systems and worked to quickly isolate those systems that were directly impacted, or at least potentially impacted. And fortunately, within 24 hours, they were able to discern that it was not Optum more broadly, or the rest of UHG, including the largest private health insurance company in the country, UnitedHealth Care. Those systems were not impacted, nor were their cloud systems impacted. They were able to isolate the set of on-prem systems that were impacted, and I think started to communicate publicly on quite regularly through their bulletin of, hey, here's what the scope of the impacts is. Unfortunately, as we have all come to learn in the last 4 weeks, it turns out the scope of impacts, even if it was quote unquote just change, was quite massive, right? Claims clearinghouses, we've all woken up to the reality of the importance of claims clearinghouses and just the centrality and the systemic nature of them. And both on the payer and provider side, Change Healthcare is the largest one. And so what were the implications, right? I kind of think of it as you got pharmacy, you got medical, and then you got all the other ancillary services, right? On the pharmacy side, their pharmacy claim system was down, but that also meant voucher verification, voucher submissions, eligibility verification, and so many other things. And that, you all saw it in the papers and you lived it in your everyday life, was causing massive confusion. Why can't I, as a physician, submit a script? A lot of that got resolved. There's still a last mile that they still need to resolve. Then there's the medical claims. This was not something that people felt immediately. They knew it was happening. They knew their claims weren't going through, or they couldn't submit claims. Or if you're the payer, that you weren't either receiving or able to make payment. Everyone sort of knew the dynamics, but you don't really start to feel that until weeks 3, 4, 5, 6, because you can rely on cash on hand. And there is obviously a lag from when you submit a claim and when you get paid. But as the weeks have progressed, that has increasingly become our main focus. And of course, there's all the other, lab process, labs, RADs, all the other things they do that are also linked to that system. So what was the reaction? What did we do? So first, we had to better assess the situation, right? Again, clearinghouse, not your typical cyber attack that we deal with. We often deal with hospitals, health systems, suppliers getting attacked, device companies getting attacked. This was relatively new, especially from a scope and scale standpoint. So we talked to the associations. We spoke directly with physicians and physician executives in our network. We began to work with and talk to clearinghouses, other clearinghouses. What are you ready to do? How can you build capacity? We worked across the interagency. What is the full universe of options we have in the federal government to step up and stand up in this moment, given what we think might be coming? And then, of course, on a daily basis since February 21st, oftentimes day and night, and absolutely 7 days a week, we worked very closely with UHG, not only to, of course, hold them accountable, but also to support them, because they were also, subject to a major attack. And they were also trying to figure out, where do we go and how do we do it? They might have the best advisors and consultants in the world, but it's a pretty lonely spot when you realize you've got billions of dollars of systems that impact much of the healthcare system across the country going down, right? So since then, like I said, pharmacies largely come back online. We're still worried about the hundreds of independent pharmacies that are not online. We're still worried about critical functions like infusion that people can't submit full claims for, or having to still use many manual workarounds for. But the big piece is what you guys have done as providers, right? You guys have found workarounds. You guys have switched clearinghouses, whether within Optum's network or to other clearinghouses. You guys have, figured out how to link back up to your payer portals and make various submissions. You guys have found ways to move money to make payroll, to support your teams. So you guys are honestly the biggest heroes in this moment. And we really want to continue to support you and make sure that every single last provider is able to continue providing care. Because ultimately, like DepSec said, the thing we care about most is every American person has perfect access to healthcare. That is what we strive for every day. And you are our conduit to enable that. So where we are now, after we stepped up, as DepSec said, and provided those advanced and accelerated payments through CMS, after UHG has done what they've done, and after getting all these manual, very importantly, and frankly, most importantly, making all these switches to other clearinghouses, which while those clearinghouses aren't perfect, you don't have 98% claims edits when you have a quick workaround. You don't have some of the other functionality, but we're able to get money flowing so we don't end up in this most dire cash flow crisis. We believe we're at about 95% of claims are flowing across the country on the medical side and well over 99 on the pharmacy side. So our entire focus right now is what DepSec said. Let's focus on the last mile. Let's make sure we work with the payers, especially United, but all the payers, in making sure you all know what your options are to not only access these workarounds and make these switches on claim submissions, and not only make sure, hey, if you're having trouble with things like prior auth, that you're able to, to work with your payer to address those, but very importantly, that you have the opportunity and access to advanced payments insofar as you need them. So that's where we are. It's going to take weeks. We're not going to be completely out of the clear for several weeks, but we do think in the next several days, we should be, closer to 99% on the medical claim side. But again, I just, having been in this cybersecurity space quite intimately for the last couple of years, I can't thank you all enough for how much you've stepped up in this moment. And with that, I will pass it to my very incredible colleague and friend, Stacey Sanders from HHS. She's a counselor to the Secretary. Stacey.
Great. Thanks, Syed, and really glad to be with you all today, and thank you for your continued engagement and for reaching out to the Department of Health and Human Services. So as you heard from the Deputy Secretary and from Syed, here at the department, we are really leading by example in response to an unprecedented cyber attack. And shortly, you'll hear from my colleagues at the Centers for Medicare and Medicaid Services about the solutions that they have put forward, the policies they've announced to assist the provider community and really bridge cash shortfalls. From day one of this attack, HHS really has worked daily with the UnitedHealth Group, with Change Healthcare, alternative clearinghouses, other insurers, and healthcare provider associations, and more. And throughout those many conversations, as you heard, it has become clear to us that we really do need to focus on those cash shortfalls and making sure that providers can make payroll and that they can continue to meet patient needs. And what we have realized is that we really need other healthcare payers and insurers to follow the department's lead. And that is exactly why the department issued a call to action in a letter from HHS Secretary Javier Becerra and Acting Secretary of Labor Julie Su, urging that the government and private sector work together to ensure that providers can continue to deliver that essential care. Following from that call to action, the department has really served as a lead convener. We have brought together healthcare providers and insurers to surface solutions, and our leadership just met again with the leading payers yesterday. As a result of these actions, the department, alongside our partners at the White House, have secured commitments from insurance companies to conduct more proactive outreach to providers who are facing cash shortfalls in the face of this attack, to ensure that those payers will be prepared when claims volumes increase, and to provide advanced payments to providers that need them. Because we know that the healthcare provider community is reliant on many payers in order to pay their staff, to do their good work, and to meet patient needs. Looking forward, we're committed to making sure that every single provider who needs support, whether that means guarding against future cyber attacks, standing up new systems to process claims, or seeking financial assistance, can get it. We're really focused on that last mile. We want to hear from you. We want to get you connected to the solutions that UnitedHealth Group and Change are making available, and we want to connect you to other payers. And so we'll provide resources through the remainder of this webinar to both answer your questions and make sure that you get connected to the answers and the resources that you need. So thank you so much for everything that you do, and I will turn it over to my colleagues at CMS.
Thank you. Good afternoon. My name is Hannah Catch. I'm a senior advisor in the Office of the Administrator at the Centers for Medicare and Medicaid Services. It's great to be with you today. And I'm going to speak primarily about the Medicaid side, and then my colleague Will Harris will speak to the Medicare side. We have heard from so many providers over the last several weeks who are really struggling to make ends meet right now, or who are worried that they will not be able to make payroll in the weeks to come. And I just want to say, I know many providers have been able to implement workarounds to begin submitting claims, but I also know many providers have not been able to implement these adjustments for many reasons and are facing very significant cash shortfalls. I also want to acknowledge that some of the providers that are having the hardest time right now are the small practices and safety net providers, many of whom are serving underserved communities. So first and foremost, I'll just echo my colleagues in saying that we are in this with you. We will keep working to solve this alongside you. And I'll just say a few words here about what we've done on the Medicaid side to date, as well as what we can offer you at this point. So for several weeks, we have been urging particularly Medicaid health plans to proactively reach out to contracted providers to offer the support that you need. And we really appreciate that we've heard from the managed care plans that many of them are taking these important steps. Specifically, Medicaid managed care plans can provide interim payments and loans. They can provide support for providers to transition to a different clearinghouse, and they can pay any old pending claims so that providers have cash flow during this time. If providers are contracted with Medicaid managed care plans and you need support, I would urge you to reach out to them now. If you have already reached out to them and you did not hear back or did not get what you need, I would encourage you, if it's been more than a week, to reach out again. More on that in just a moment. In addition to the managed care side, on Friday, CMS released guidance to state Medicaid agencies clarifying that they can also provide interim payments to providers in their fee-for-service networks. So at this point, support should be available for Medicaid providers. And if it isn't, we would like to help. So first, again, please apply for all available help through UnitedHealth Group. If you have applied for the support more than a week ago, please try again. They recently updated their terms. Second, reach out to all of your contracted Medicaid plans to request the support you need. And if you've done both of these and you either haven't received a response or you haven't received the support that you need, please contact us. And Betsy, if you could just post that email address in the chat again. Thank you. I also just want to acknowledge that even if you've received support, this process is extremely labor intensive and costly, and it is deeply frustrating. I know many folks are working with paper claims or trying to update processes to processes that are less efficient than what we're used to. So acknowledging that, we hear that, and we will continue to do everything that we can to get the systems moving again. So thank you for your commitment to continuing to serve your patients during this incredibly challenging time. And please do continue to stay in touch with us about your experience and how we can help moving forward. With that, I'll turn it over to my colleague, Will Harris.
Thank you so much, Hannah, and thank you all for being with us today. My name is Will Harris. I'm also a senior advisor in the administrator's office at the Centers for Medicare and Medicaid Services. And again, thank you for being here. We obviously recognize, I want to echo what my friend Hannah said, that we recognize the impact that this cyber attack has had on the provider community and the whole healthcare sector. We've heard from many of you and your provider associations, and that kind of feedback has been critical to making sure we have what we need and the intel that we need to understand the scope of the impacts of the cyber attack. So thank you for reaching out. Thank you for continuing to do so and for keeping in touch. It's been incredibly helpful to us. We've been in frequent communication with federal partners across the government and with UnitedHealth Group and Optum. And we've also been meeting with other plans, and since the beginning of the month have been encouraging their continued efforts to help avoid further disruption. And that includes asking the private plans, including Medicare Advantage and Part D plans, to make prospective payments to providers. We've continued pushing them on that. Like my colleague Stacy said, we've gotten commitments on that, and we're going to continue pushing to have them step up. Like Stacy said, CMS has been leading by example in several different actions that we have taken. So regarding Medicare, we've taken several steps. Most importantly, perhaps you probably already know about it, on March 9th, we announced that we would be considering applications for advance and accelerated payments for Medicare Part A and Part B. There is a fact sheet available in the CMS newsroom, available with more information about how to apply for that. The short answer is that you should contact your servicing MAC, and all of those MACs should have posted instructions on how to apply for those payments since March 9th. So that's been available. My colleague Betsy is either going to post here or send later links to a lot of the documents that I mentioned, but an easy way to find them is just by Googling CMS Newsroom. Click there, and everything that you see on the front page will be documents about this right now. So that'll be an easy way to find it. So like I said, a fact sheet went up on March 9th. A very important document of frequently asked questions went up on March 13th. We took the questions that we were getting after that initial posting and made sure to answer those in a document and clarified a couple of things that we heard a lot of confusion about. That includes a lot of the questions that I saw come in for this webinar and that I'm seeing in the chat in the Q&A. So I want to make sure to point you to that FAQ because I think it'll be really helpful for you. And the bottom line there is that the MACs all have information about how to apply for these payments. And if you are experiencing financial difficulties right now, reaching out to that servicing MAC should be your first stop. We've also instructed the MACs to expedite any requests to change clearinghouses, any EDI enrollments. Those are usually like 21-day long reviews, but we've instructed them to expedite that as quickly as possible. We understand that those are happening much more quickly than normal right now. We've also directed the MACs that they must accept paper claims. I saw a question about that in the Q&A. The MACs have what they need right now to accept paper claims. You don't need a waiver or anything. They have to accept a paper claim if that's how you need to file it right now. So that if you need to do that, you can. I know that's not what anyone wants to do, but if that's where you need to be, you can do it. I also want to point out that we issued a memo to Medicare Advantage and Medicare Part D plans on March 6th that implored all of those plans to continue to provide access to covered benefits without any disruption. And that includes either removing or relaxing utilization management or timely filing requirements as appropriate. And also, we asked them to consider using flexibilities to remove or relax any prior authorization requirements while folks like you are dealing with this crisis. That's something we're going to continue to push the plans on and continue to ask them to do. We'll certainly continue to do that because we've heard from you that it's important to the provider community. So we, like I said earlier, also been pushing and will continue to push the plans, the private plans, to provide advanced funding to providers who are affected, and also to remove or relax claim filing deadlines to make sure we are rolling smoothly there. I want to make sure we have enough time to go to questions, so I'll stop there for now. Hope that was helpful, and turn it over to UnitedHealth, who I believe is next on the agenda. Go ahead, Roger.
Well, thank you very much. And just to introduce myself, my name is Roger Connor. I'm the CEO of Optum Insight, part of UnitedHealth Group. Change Healthcare is a unit within my business. Today, I'm joined by Corey Grunberg, who is Optum Financial Services Chief Operating Officer, and I'm also joined by Dr. Margaret Mary Wilson, who is UnitedHealth Group's Chief Medical Officer. Really what we'd love to do today is, one, I'm going to give a quick update as to how we're progressing and reacting to this terrible event. But also, most importantly, we want to bring to life and explain the support mechanisms that exist to support providers in all areas. And we'll go into that in a little bit of detail, but that's the key priority today, to make sure you understand the help that you can get from UnitedHealth Group going forward. Maybe from an update in terms of progress, from the very first day that this started, we've tried to make sure that, one, we get the world's best cyber experts and as much resource in to solve this situation as quickly as possible. We have literally hundreds and hundreds of people working on this currently to restore services, because we understand the impact that is having. And I just want to pass on a message of thanks and appreciation, first of all, to our partners at HHS for working with us so closely, but then also to you, the provider groups on this call, for your understanding. And I want to make sure that we give you all the support today that we can going forward. Maybe most importantly, just quickly giving you an update on how we are progressing. And we're making good progress with still some work to do. We've prioritized 3 key areas in terms of returning service. Again, this is all focused on prioritizing and ensuring that we minimize any impact on access to care and to medication. So we focused in on pharmacy, we focused in on the payment process, and also on claims submission. I'll talk about claims because that's the one that is the toughest, but we've made progress. Yesterday, we started processing and launching our software system for claim submission called Assurance. This is one of the largest software systems in the healthcare system, and we believe that's a big step forward. Then towards the end of this week, we will connect that software system and open up our biggest clearinghouse, the Exchange Relay, as it's called, and that's going to allow, again, claims to flow, not for everyone, but for a population, and we're going to be doing that in a phased and controlled manner. Then on pharmacy, we've made good progress. We've made progress on e-prescription and on claim submission, but we know there are a couple of hotspots, particularly on infusion, where medical claim submission processes are required. So we're making sure that we identify any hotspots in that pharmacy area and address them. And then on the 15th of March, we restored the Change Healthcare payment mechanism. This is a specific payment rail that connects payer to providers, and we knew there was disruption. We've reestablished that from an electronic perspective, and that's starting to flow as well. So the headline for me, good progress with more to do, and we will continue to communicate as we make that progress. I think most importantly, I think I hand over to Corey now, who will explain our provider funding mechanisms that we have in place. You may have seen our headline yesterday. We have already distributed over $2 billion in funding, but Corey will walk through more of the detail.
Thank you, Roger, and thanks for having me today. I'd like to share with you on March 1st, the company launched a temporary funding assistance program to help bridge the gap in short-term cash flows needs for providers impacted by the disruption in Change Healthcare Services. If we can go to the first page, please. The company has listened to provider feedback and expanded the program to provide further funding solutions for its provider partners. UnitedHealthcare and Optum have expanded provider funding programs. Eligible providers under this program now include UnitedHealthcare medical, dental, and vision providers. And for UnitedHealthcare, the funding is based on the difference between historical weekly claims payment volume pre-disruption compared to weekly volume post-disruption. In addition, providers who receive payments from payers that are processed by Change Healthcare are also eligible for the funding program. And thirdly, providers who have exhausted all available connection options or may be in the process of implementing technical workaround solutions and who work with a payer who has opted not to advance funds to providers during the period when Change Healthcare system remained down are eligible for this program. The company also continues to evolve its funding support to make it easier for providers to check eligibility and navigate short-term funding needs at no cost, which will remain a priority until all systems are fully restored. Since the cyber attack, the company has engaged with several thousand provider organizations to help them with their short-term cash flow challenges, from large regional health systems to small rural independent physician practices. The funding assistance program now extends the repayment period to 45 business days to provide even greater flexibility. In addition, Optum, UnitedHealthcare have launched a series of educational on-demand webinars to help providers and customers learn how to reconnect our claims and payment networks and to explain how to take advantage of our temporary funding assistance programs. On the next page, we'll talk a little bit about the process for the temporary funding assistance programs. So on the left-hand side, you see the temporary funding assistance landing page. This can be found at the website link below. Now, the temporary funding assistance website allows for providers to first, if they want to, determine eligibility before logging in or even creating an Optum Pay account if they don't have one. But once a provider has an Optum Pay account, they can go to the landing page here. They can log in with a secure One Health ID and then see the funding acceptance page. A provider can, on that funding acceptance page, can accept one or all of the funds available to them, accept the terms and conditions, enter contact information, and click submit. A provider will receive a confirmation page and a confirmation email. The funds will be in the provider's bank account on record in standard ACH processing times of 2 to 3 business days. Now, some providers will come to this page and they will see that the funds that are preloaded for them do not meet their needs. We also have a solution for them. On the next page, I'll talk a little bit about that process and our exception process. So if a provider goes to the page, sees the eligible funding, and it doesn't cover their short-term cash flow needs, they can fill out the temporary funding inquiry form, and this will go through our exception process. And I encourage providers who require assistance with eligibility or additional financial support to submit the temporary funding inquiry form. That will be processed by our teams, and you will receive a response within 1 to 2 business days, oftentimes over email, that your funding has been approved and you can log into the portal to go accept that funding. That's the process that we're following. That's how you log into your OptumPay account. You accept funding that's there, and how you can inquire about additional funding should the funding that's preloaded not meet your individual needs. Next, I will turn it over to UnitedHealth Group's Chief Medical Officer, Dr. Margaret Mary Wilson.
Thank you, Corey. First, I would like to thank all the providers, thank all of you for the care that you provide to your patients. As a physician myself, I know how important it is for us to communicate directly with all providers and their teams on the available help that UnitedHealth Group is offering. And so what I'd like to do is give you a snapshot of the efforts that we are making to engage directly with providers through multiple channels in order to help raise awareness of our provider relief programs. So as Corey mentioned, we have created an on-demand webinar that walks providers and their administrative staff through the details of the programs. Over the weekend, we sent direct emails to nearly 70,000 providers regarding our temporary funding assistance programs. Yesterday, we sent direct emails to another 100,000 providers, and today we are sending emails to another 100,000 providers. Throughout this week, we're going to continue direct outreach, all with the intent of driving engagement to the provider webinar. We are also leveraging the bi-weekly UnitedHealthcare Provider Bulletin, which reaches the majority of the providers in the UnitedHealthcare network. We have conducted proactive outreach calls to more than 12,000 providers, sharing information about our alternative claims submission methods and also information about our advanced funding programs. Our direct outreach has been focused on the populations that are most at risk, including those who are served by federally qualified healthcare centers, infusion centers, home and community-based programs, children's hospitals, safety net hospitals, rural health clinics, and Indian tribal clinics. We're also targeting your associations and have conducted outreach thus far to more than 60 payer and provider associations. Finally, we've also taken steps to reduce the administrative burden on hospitals and providers, including the following. In the Medicare Advantage space, we suspended prior authorization for most outpatient services, and we also suspended utilization review for our Medicare Advantage inpatient admissions until March the 31st. With reference to Medicare Part D, we suspended drug formulary review processes until March the 31st. And from the standpoint of pharmacy, we are reimbursing all appropriate pharmacy claims that were issued with good faith understanding that the medication would be covered. So these are just a few examples of the many avenues that we are pursuing to engage providers. We do recognize that the fragmentation within the US healthcare system does result in uneven experiences for providers. And we know that many providers, particularly those serving smaller and rural communities, are struggling. But I do want to assure you that it is a critical priority for us to continue to work with stakeholders and with you to ensure continued access to high quality care for people who need it. We appreciate the ongoing support and partnership, and we look forward to working with the administration, with Congress, and with stakeholders around this table and others, and all of you, to ensure that our nation's healthcare infrastructure is protected from future cyber attacks. Thank you. And Betsy, I'll turn it over to you.
Thank you, Dr. Wilson, and thank you to all of our speakers for joining us today. I realize that we are getting close to the end of our call. However, I think we have some speakers who can stay on a little bit longer and answer some more questions. However, I do want to recognize that we have more than 100 questions in the Q&A box, and we received more than 60 ahead of time. So we don't want you to think that we don't value the questions you have. There just simply is not enough time for us to get through all of them. I will also note that we received a number of questions ahead of time about the Office of Civil Rights investigation into the cyber attack. And because this is under active investigation, we cannot respond to those questions. But we wanted to acknowledge that we did receive them. So the first question I have is actually for our colleague, Brian Mazanek, the Deputy Assistant Secretary and Deputy Director for Preparedness at the Administration for Strategic Preparedness and Response. And the question is, what is HHS, specifically CMS, doing to protect its systems from similar cyber attacks?
Great, thanks, Betsy, and appreciate the chance to be with the provider community today. So in terms of CMS protecting its systems from similar cyber attacks, so the Administration for Strategic Preparedness and Response, ASPR, the organization to which I belong, serves as the sector risk management agency for HHS and leads incident response, coordinated with the interagency, but also within HHS in evaluating the impacts of any particular attack. As part of this effort in the context of the Change Healthcare attack, ASPR, in close partnership with the HHS Office of the Chief Information Officer, facilitated a department-wide scan for impacts of the Change Healthcare incident on HHS systems. And while some of the HHS divisions have experienced operational impacts, as many of you are all as well, related to the attack, we found no direct related breach of HHS network. So that's important to note. HHS Office of the Chief Information Officer leads the internal HHS cybersecurity efforts and is working to ensure that HHS networks, including CMS's networks, are safe, secure, often by implementing the same cybersecurity best practices. We are encouraging industry, all of you, to adopt as well, particularly the healthcare and public health cybersecurity performance goals that we rolled out at the end of January, which we believe will position healthcare organizations to implement high-impact cybersecurity practices that are really scalable and critical to addressing the kind of vulnerabilities that can lead to attacks like the one Change Healthcare is experiencing.
Thank you, Brian. Another question we received that I think this is best for Stacey Sanders, Chief Competition Officer and Counselor to Secretary Becerra, to answer. Insurers and PBMs have skirted conditions of participation, and is there anything we can say about the steps we are taking to ensure accountability?
Yeah, that's a great question. And I'll just say that accountability is extremely important to us here at the Department of Health and Human Services. I would point folks to the President's competition agenda. The President in 2021 created an executive council on competition and released an executive order. We have followed through on a number of actions across the department, really focused on lowering costs, promoting transparency, and rooting out corporate greed in healthcare. This incident, this cyber attack, raises a lot of important questions about accountability. And I can assure you that we'll be looking into those issues, not only here at HHS, but also with our colleagues at the Department of Justice and the Federal Trade Commission.
Thank you, Stacey. So another question we've received is on timing related to advanced and accelerated payments, both for Medicare and for UHG. So Will and colleagues from United, if you could please respond.
Sure thing. Thanks, Betsy. And I saw several questions in the chat asking about timing and things around that too. I did post in the Q&A, if you go to the answer tab, you should be able to see the link to our FAQs. So I would point you there to that public information that we have up. In there, we do say that we're continuing to monitor the circumstances here and will provide more guidance if needed in the future. But in general, this is working just like our advance and accelerated payments usually do, where repayment begins starting with the demand letter that comes 90 days after the payment is made. And then you pay back the advance payment through claims. That's all explained much better than I will be able to do in a couple of seconds in the fact sheet that I also linked in the Q&A. So I would point you there and also to the FAQs that I hope you find valuable and do a better job of addressing those questions. I'll turn it over to Roger for UHG.
Yeah, Will, thanks very much. Just in terms of the support mechanisms, I'll keep it really simple. Where we've got visibility of the impact on a provider, whether that's because they happen to use the payment methodology or we're part of UHC and have had some claims disruption, we've used that data to calculate a number, and that's what Corey has referenced on the website. But don't worry, sometimes people go in and they're not a big user with UHC and others, and they see a small number and that doesn't meet your needs. Don't worry, that's what the third program is there to do. It's there as a catch-all to make sure that if you've had some disruption through the claims process, you can go in and tell us the level of financial support that you need. And so where we are providing payment in advance for UHC customers, yes, we can make sure that we balance that through claim. But there are many providers coming in to take funding where we're just going to provide that, and we'll rely on another repayment mechanism over time. Just to be super clear as well, because there was some confusion over this, any money that we lend in advance in terms of this temporary funding, we're not going to ask for it back until this situation is resolved. We want to do the right thing and make sure it is there to support you. No interest, no fees associated with that. And when things do settle down and get back to normal, that's when we'll ask for repayment, and that'll be 45 days later. So just a little bit more detail on our support mechanism.
Thank you, Roger. Appreciate that information. Another question for you and perhaps Will is, once approved, do providers need to resubmit weekly to receive payments? What is going to be the trigger to end these payments? I think you touched on that a little bit, Roger.
Yeah, maybe just to expand, our plan is weekly. What we see is that the situation does vary by provider weekly. So for example, if you're about to hit a payroll week, we're seeing that that's bigger than another week. So we don't want to get that wrong and give a number that doesn't see you through a challenging week. So what we've asked is that this is a weekly process. That's the over $2 billion that we've released already. You come in, you ask for that funding weekly, we get it to you, and then you come back in the next week, and we update that based on your needs. So it is a weekly process. But just to reiterate, we won't come asking for anything back until this situation is resolved and we see that normal payment claim process working again.
And I'll just briefly answer with one thing you won't be surprised by, which is that this is addressed in our FAQs that I would certainly point you to, and I'll keep putting that link in the answers to Q's and A's, but we have not set a projected end date for this. If you are experiencing financial hardship and you would like to apply for an accelerated payment, if you're a hospital, or an advance payment, if you're a provider, please reach out to your MAC, and that will be your best first stop to get that in process. But we have not yet set an end date for that. Thanks, Betsy.
Thanks. And before you go off camera, Will, another question we had gotten is for HHS Medicare support. Are there any restrictions, like can pharmacists be eligible for funds, or independent practitioners such as psychologists be eligible for funds?
Yeah, good question. So you can apply for these programs if you receive payments from them. So if you receive payments from Medicare Part A, if you're a hospital, you can apply for accelerated payments there through your MAC. If you are billing Part B, you can apply for those advance payments from Medicare Part B. So again, that is more specifics about that are laid out in our fact sheet that was posted on March 9th. So definitely want to refer you there for more details for specifics on that. But in general, you'll be looking to go to your MAC to apply for that funding that you would usually get from either Part A or Part B. So that's where you should go for that. And so for pharmacies specifically, I saw that question come in for pharmacies. If you are a Part B as in boy enrolled pharmacy and you are usually billing for Part B services, reach out to the MAC who you usually work with for more information. Thanks, Betsy.
Thanks, Will. So while I realize, like I said, we have a lot of questions, we are running short on time. We will be sending much of the resources that have been referenced throughout this call in an after event email. So you have access to the FAQs, to the notices, to the email address to send issues to. But we want to thank you for your time and all of the hard work over the last 4 weeks to keep care continuing to be delivered to patients. And we also appreciate all the questions that are submitted because they help us understand where there are still existing problems and where there is more guidance needed. So again, thank you for your time. Thank you to all of our speakers and have a wonderful day.